Just moments ago, the FDA granted full approval to the first Alzheimer's drug to show that it could slow the disease's progression in certain patients.
This is promising. The decision is expected to dramatically increase who has access to the drug. But our Dr. Frank McGeorge is here to explain why there's still much debate over this medication.
There sure is, Kim and Devin. So the drug lecanemab won accelerated FDA approval in January based on the fact that it clears amyloid plaque buildup in the brain that is associated with Alzheimer's. But it only slows the progression of disease. It doesn't stop it. And some experts argue there simply isn't enough bang for the buck. But many patients desperately want the opportunity to try it.
6 years ago, John Monmany saw a neurologist for what he thought were a few minor memory problems.
She came back and said, "You know what, Joe? You actually have younger onset Alzheimer's disease. You're likely going to start to experience declines in the next 5 years. And you may not recognize your family in 5 to 7 years."
He hoped to try lecanemab when it won accelerated approval earlier this year, but Medicare declined to cover the drug until the FDA granted a fuller traditional approval. Without insurance, the medicine sold under the brand name Leqembi costs $26,500 a year.
You had this treatment at your fingertips, and suddenly you had Medicare saying, yeah, but you can't quite get access to that at this point in time.
A larger trial found Leqembi can slow the progression of Alzheimer's disease by about 27%. But neurologist Dr. Lawrence Honig warns Leqembi is not a cure, and those with more advanced symptoms won't be eligible to receive it.
We're already having these conversations that sometimes aren't so easy. It's not that we know it's not good for people with moderate or severe disease, it's just that we don't know.
There's also a risk of side effects. About 13% of patients receiving the drug in its trial had brain swelling, and 17% had brain bleeding, compared with 9% in the placebo group.
There we go.
Leqembi is administered through IV infusion once every 2 weeks. Joe is hoping he'll be able to get it for a chance at more time with his wife and 2 sons.
Like any parent, I would love to see them actually get married and have a family. I just want to experience many of the activities that most people take for granted.
Now, the drug is only for people with early forms of Alzheimer's disease, those with mild cognitive impairment or mild dementia who have been confirmed to have amyloid plaques in their brains. Experts estimate that group makes up about a sixth of the more than 6 million Americans that are currently diagnosed with Alzheimer's.
Interesting. So there's approval, but safe to say the research isn't done yet, really.
No, it's not. In fact, part of the approval process is going to require Medicare coverage in that prescribing physicians participate in data collection on how the drug works and enters that information into a database. The hope ultimately is to really gauge the real-world usefulness of the medication on a much broader scale and basically get a lot more data on how effective it is.
Yeah.
So much hope, though, riding on this
There
class
is.
of drugs.
Absolutely.
Thanks, Dr. McGeorge.